You've been diagnosed with urge incontinence. So urge incontinence is the inability to hold your urine when you want to or should be able to hold it. Frequently, we'll refer to it as the gotta go right now type of incontinence, and that's based off of a commercial that was done probably about a decade ago. The other way that I think about it is I talk about something called the key sign, which is where you get home from the grocery store, you put your key in the door, and before you've even unlocked the door, you've got that sensation like you've got to get to the bathroom right away. You can't put down the groceries or otherwise you're going to be sorry. That is an uncontrolled urge to urinate, and that is what is classic for urge incontinence. Now, urge incontinence can be caused by many different things. Sometimes it's people that have a, quote, small bladder. Sometimes it's because of medications that they're taking or non-pharmacy medications like caffeine that you're drinking a little bit more than you should. For some people, it's orange juice or tomato juices. They can irritate the bladder and cause it to want to empty more frequently. A urinary tract infection is actually probably one of the most common causes of it because it irritates the bladder and the bladder wants to get that irritant out, and so it'll start to squeeze, and that's why you have increased frequency with a urinary tract infection. So there's a lot of different causes for it, and that's one of the reasons that we would encourage you to start with your primary care provider. But once we know that it's not something easily fixed, like a urinary tract infection, then we have to look at other ways to try and help control it. So similar to stress incontinence, one of the first things that we talk about with urge incontinence is physical therapy for the pelvic floor. Now, in stress incontinence, the physical therapy was to strengthen the pelvic floor to be able to hold the urine in. With urge incontinence, we still want to strengthen that pelvic floor, but this time we're trying to be able to control that urine. So think back to if you have children and you're potty training, right? You would do it on a timed basis initially because you didn't know when they were going to need to go. And then you would slowly lengthen that period of time. And what you were doing is essentially training their bladder to be able to hold more and more urine over time. And that's what our physical therapists can help with as well. They can help to show you how to better control your urine by using your pelvic floor muscles to give you more support, so that when you put your key in the door, you then can recruit your pelvic floor muscles and give you enough time to get to the bathroom and be able to empty your bladder. So that's usually our first step. I also talked about weight as a factor with stress incontinence. And I would say it's also a factor with urge incontinence. So trying to be of a healthy weight is always going to be beneficial. And of course, eating healthy food is also going to be beneficial because there's a lot of chemicals that are in our processed foods that get filtered through our kidneys and end up in our bladder. But again, when they are processed chemicals, our bladder doesn't always like them, and so you will find that certain foods increase your frequency of urination. Carbonated soft drinks are a very common one. Anybody who drinks beer knows that they have to go to the bathroom much more frequently. So those are things that you just want to keep an eye on, make a mental note of it, maybe even keep a diary of what you're drinking during the day and finding out which of those things is making you go more frequently or having a harder time controlling it even. So after we've done those kind of very fundamental looks at what can make life better, then our next steps are looking for pharmaceutical or medications that can help you. And there's multiple different medications out there that you've, I'm sure, heard of. They're on the commercials frequently. One group of them is called anticholinergics. And anticholinergics are like the Detrol, Ditropan, Vesicare, oxybutynin. They all actually work quite well. However, they all have two common side effects. One side effect is a dry mouth. And so usually we would encourage you to take those, at bedtime so that it tries not to dry your mouth out so much. And then the second side effect that many people will have is constipation. So we certainly want to have people watching to make sure that they don't get too constipated on them. And then in the older population, it can have some issues with memory. So again, we want to be very careful with those medications, but usually those medications are the first line of treatment after we've done the physical therapy, made sure there's not a urinary tract infection, and looked at our food or drink intake. Then after the anticholinergics, there's another group of medications called beta agonists. Myrbetriq is one of the ones that you may have heard of. And that one works slightly differently than the anticholinergics. So the anticholinergics help to block your bladder from squeezing. So again, think of the urge incontinence like a spasm. So the anticholinergics help to block that spasm so that you have more time to get to the bathroom. The beta agonists, like the Myrbetriq, instead of blocking the spasm, it encourages the bladder muscle to relax more so that it can hold more urine. So they work slightly differently, but with our limitations with insurance, we are many times needed to try the anticholinergics first, and then if they don't work, then we can try the beta agonists to see if those work better for you. Now, again, this isn't a one-size-fits-all. So if those two things aren't working, there is another treatment that looks at the nerves that go to your bladder. So the nerves that go to the bladder start down by your sacrum in what we call the S3 area. So in the S3 area, there is a nerve that comes around to your bladder and it helps to stimulate your bladder. Now sometimes that nerve can kind of get a short circuit in it. And what they have found, this has been over 20 years of research, is that if we send a small amount of electrical signal to that nerve, think of it like a pacemaker, we can give you better control of your bladder. So this procedure is called InterStim, and it's a procedure that it's one of the few, and if not maybe one of the only procedures where you can take it for what I call a test drive first. So what I mean by that is we'll have you come into the office and we'll put this little wire, kind of like an epidural, but there's no medicine that goes through it, it's just for the electrical stimulation. We put this little wire in by your sacrum, and then we tape it up to your back, and then we send you home with a little control box for it, and we see how it works for about 5 to 7 days. And what we're looking for is, do you see an improvement in the control of your urine? And if you do, then that means that you'd be a good candidate for the permanent placement of that. And if you didn't, then we know that you don't need to waste your time on doing that procedure. So it's kind of a nice procedure. Actually, it's a really nice procedure for a lot of women. It also, interestingly, can be used on men for the same reasons. I just don't treat men for that. But the InterStim is a really great option for a lot of people. And then there's one other nerve treatment that treats the posterior tibial nerve in your calf that can also help with urinary incontinence. That particular procedure I do not do, but I do know of individuals that do the procedure, and so I can always get patients in contact with them. But it involves coming in for weekly stimulation of that nerve to try and get better control of the bladder. So again, several different treatment options, anything from the physical therapy, using the weight loss, using medications that you take by mouth, or what I like to refer to as the pacemaker for the bladder, which is the InterStim, that can really significantly help control that urge incontinence. So again, you can live your best life, you can do the activities that you want to, You can go on the family trip that you want to and not have to stop every 20 minutes to go to the bathroom. And that's what our focus is.